Today I will talk about fainting, also called as syncope, which happens in almost on routine basis. So first, to start with, the commonest possibly is the vasovagal syncope. If you think of the school days during the summer months in assembly, almost always every day one person used to faint and just fall on the ground. Teachers will rush and they'll give some water, sprinkle some water, and he would wake up. So that is one of the commonest causes. And what happens basically in syncope is that the blood pressure drops for a short period, and as you can understand, the heart has to pump blood against the gravity for it to send the blood to the brain. And if BP is low due to some reason, heart is unable to send the blood to brain, and as a result, the person has feeling of dizziness or something like a blackout, and the person falls, becomes unconscious for a brief period, and on the ground the heart and brain, they come at the same level. The brain gets the blood supply, and without much ado the person recovers. So that is the commonest cause of fainting. In that case, in the summer months, possibly they are dehydrated, and also the BP drops because of the sweating. Many factors are there. Now also we'll look at some of the other reasons which could lead to transient or short duration syncope or fainting. So in that, the first thing on the list is something called as micturition syncope. So in this condition, what happens is the person wakes up in the middle of the night to go to washroom to relieve himself or herself, to pass urine, and after passing urine, as they are coming back to the bedroom or walking, suddenly they fall on the ground and lose consciousness. So this is another situation. Something similar happens what I described. So there also, when a person is in sleeping position, lying down position, and then he stands, so automatically there is a drop in blood pressure. But in most of us, the BP will stabilize within the first few seconds. But in some people, it may not happen. The BP may remain lower for some more time, and then after passing urine again in the standing position, the BP may drop a little bit more, and then because of that they faint. And as the BP improves, they regain consciousness and they are better. Another situation where this can happen is during violent bouts of coughing, what is called as cough syncope. So a person may start coughing, and what you can understand, while coughing the lungs will expand, and then the heart is constricted. So the amount of blood that can return from the heart is lower, and then that can result in lowering of the blood pressure. And again, something similar can happen. The person may be sitting and violently coughing, and suddenly he falls on the sofa or the ground, and then for 30-40 seconds he or she is unconscious, and then they wake up and they are fine again. One more thing which can cause this kind of situation is something called as defecation syncope, where a person is trying to may have constipation and straining at stool, and after severe straining at stool, again something similar happens, and the person can have drop in the blood pressure and have an episode of defecation syncope or vasovagal syncope there. So these are some of the and other rare conditions are some, if the person is having severe pain, like very painful condition, because of pain also this reflex can be exacerbated and leading to drop in the blood pressure and fainting. So these are all common conditions, but there is no need to get alarmed, because these are self-limiting in nature. Main thing is to keep hydrated, especially where there is a risk of dehydration. Drink adequate amount of water, and if there is risk of something called as postural hypotension, especially those who are taking BP lowering medications, so when you are lying down for a long time and you want to walk, it may be better to sit on the bed for 15, 20, 30 seconds till the BP stabilizes, and then start walking. And for men, it may be useful to sit and pass urine in the middle of the night, so that the risk of any injury due to fall may be lowered. And whenever in doubt, it is always good to consult your doctor, get evaluated in detail to see if any underlying other causes are there which are causing this drop in the blood pressure or fainting episodes, so that the root cause can be identified and treated.